as you can see, since we recorded this talk and my intro, we've had a shelter-in-place order come through the Bay Area, and so we'll be doing the questions from each of our homes. I'd like to welcome James Nestor.
Thanks a lot for having me. Hey.
Hey. Thanks for being here. And we also have Dr. Kevin Boyd, a Chicago pediatric dentist and a sleep medicine consultant, as well as an assistant professor of anthropology, which I think is such a great combo for what you're working on at the University of Arkansas. And I'd love to welcome him into the stream too, because I know we're going to have a lot of medical questions.
So glad, Kevin,
Dr. Boyd.
I'm here. I'm glad to be here.
All right. Well, and I'd love to, how did you end up being both a pediatric dentist, sleep medicine consultant, and a anthropologist?
I got really sick of drilling teeth, and tooth decay is 100% preventable, and didn't want to make a living, putting out sugar fires, and got curious in the origins of tooth decay, which led me to the origins of malocclusion, crooked teeth. And James did a beautiful job of describing how that happened. And they didn't teach us that in dental school. So I had to go back and almost get a bachelor's in anthropology. And then it led to mentoring PhD research in anthropology, dental anthropologists. So that's all, just curiosity and anger at my own education.
That's great. And James, do you want to say a little bit about how you found the researchers like Kevin here for
Sure. I thought I had
book
the whole breathing field pretty well worked out. In nonfiction, what you do is you write a proposal, and I spent about 6 months writing a proposal, had all the chapters, had all the researchers, and it wasn't until I got much deeper into this research that I was missing a huge piece of the puzzle, which is, why are we breathing so poorly? It's not just anxiety. It's not just from the environment, from pollution, from allergens. It's an anatomical problem. And once I discovered that, everything really opened up in a whole very weird new way, as you saw from some of that research in the talk.
Cool. And I mean, I'm really curious. I mean, it seems like 90% of the things that you kind of discovered here have happened in the last 100 to 200 years. It's not really human evolution at that kind of rate. It's just some deformations. And so do you think in a few generations, or 5 to 10 generations, we could get back to our straight teeth, large airways?
Well, the human body is malleable, just as we've injured it, we can get it back, certainly. I think it's going to take a while. I think that these things can come on very quickly, but to help repair them might take a while. And I think that we really need to change how we're eating food, other environmental inputs, our oral posture, and so many other things that really are contributing to not only crooked teeth, not only poor breathing, but look at all the other diseases of civilization out there. The top killers in the world weren't really around that huge numbers 200 years ago. If you're looking at diabetes, if you're looking at heart disease, so many other issues.
Right. And I'm curious, Kevin, how widely accepted is this into the dentistry world and orthodontics and medical world? Where do we stand in how this is penetrated into the field?
Well, like anything, I was trained to drill, fill, and bill. And orthodontists are trained to, straighten crooked teeth in teenagers. And I was making a great living at just meeting the public demand. And orthodontists, the public expectations are being met. And so we can make good livings at it. But like I said, I became very discontent. I don't want to do that. These are preventable diseases. Crooked teeth is preventable. The World Health Organization has 2 initiatives: ending childhood obesity, ending childhood tooth decay. What does that mean? That means it can go away in a generation. You asked the question. That's a great question. And I proposed, not officially yet, but proposed ending childhood malocclusion. If it's not as a result or a symptom of a syndrome, these are preventable things, and they can go away. Now, they won't completely go away, but we can mitigate these huge pandemic numbers, of tooth decay, obesity, and malocclusion. So that's it's being met with resistance by people who are very comfortable
Right.
making a good living at what they were trained to do. And what's the matter with that? I don't shame them.
Right.
I broke out of it. I don't know why.
And I'm sorry, can you remind me what malocclusion is?
Malocclusion is just poor alignment.
Poor alignment.
Crooked teeth. James was
Crooked teeth.
that was good. It was crooked teeth. Poorly aligned jaws and teeth. That's malocclusion.
Nice. And I love the part where you went into the Paris underground to get a sense of some of the skulls, and we had a great talk from some of those guys a while back who were amazing enough to both fly from Paris as well as kind of let us into their amazing world. But I wonder if you could say a little bit more about that trip.
Yeah, as a journalist, I didn't want to just phone it in, and this was right at the beginning when I had found Kevin's research and found Mariana Evans' research, and I just wanted to sort of more deeply understand it. And I had the opportunity through some contacts at the Long Nail Foundation to do this, and I figured I might as well do it. Did I learn anything revolutionary as far as research goes? No, I didn't, but I was curious to see it for myself, because I was, even though the proof was all over the place, I was still doubting it, that why hadn't I learned this earlier? And all you have to do if you doubt it is just look at ancient skulls and then look in the mirror and look at the difference. So if this is controversial, I can't really understand that, because the proof is all over the place. And being down in the Paris quarries was just a way to try to see that face to face, get a little more intimate with the subject, as it were.
Right. All right. Well, we have some questions from the streams. Forrest Pound, who actually works with us on this stream, he has a 3-year-old that is too young for breathing exercises, or is she? But it should they be considering dietary changes like brown rice and things like that at this point?
Kevin, this is right up your alley. Pediatric dentist. I'll let you take this one.
Yeah, depending on where she lives, she should establish a dental home, we call it, by age 1. So she's already been to a dentist, even if it's a specialist, depending on where they're trained. They don't know about this. I mean, this is only starting to come to light and enter, hopefully, the curriculum of dentistry and how they teach it. So eating hard food, James talked about breastfeeding, and weaning is really important. Those terms should never be separated. Nursing and weaning, breastfeeding and weaning onto hard, unprocessed foods. So right now, the question was about food. Yes, chew, celery, carrots, apples, boom, boom, boom. But at 3 years old, that kid is entering into what I call a geriatric patient. I like to get him at 2.5. I can start expanding a kid and helping the jaw grow. But they're going to look at if that dad walks into a pediatric dental office and says, look, I think my kid might need expansion, they'll think he's crazy because this isn't taught in school yet. It will be, thankfully, for what you're doing. This might help change it.
That's interesting. So yeah, finding things to chew on. The chewiest foods, the better, huh?
Yeah.
It's interesting. My family always made fun of me for only eating raw vegetables because they're from the South and they boiled everything to death. But I ended up with basically straight teeth, and I never even saw a dentist just because we didn't really have access to them until I was almost in college. So my teeth kind of may have benefited from that as well. I wonder if that was it. Let's see, we have David Madden from one of our feeds who said he loved your talk, and that he'd really love to hear more about the changes that take place in the womb and what's causing that. It seems like you had some of your slides that were showing that. They haven't even got a chance to chew yet, right?
No,
Yeah,
that's right. And this is something that just absolutely blew my mind, that these are heritable traits. So it brings up the question is, how can this be happening if this kid isn't, being trained to correct oral posture, or it doesn't have the chance to breastfeed? And this is something that Kevin and I were just talking about a couple of weeks ago, gestational apnea. And I think that he would be the the better person to explain this, because it does get complicated.
Babies do chew, fetuses do chew in the womb. They chew amniotic fluid. Yeah, they develop the sucking and swallowing on about mid-gestation, 20 weeks, 25 weeks. And we have ultrasounds of kids, and they're, you can't do this experiment. This is not, a hypothesis that can be explored. Like, you can't go back in time and look at a kid on an ultrasound 500 years ago, but you can see stillborn, fetuses at 20, 25 weeks and compare them, like James showed that slide of, what really a fairly typical ultrasound looks like at 20 weeks. So we have proposed a hypothesis at Tufts University Dental School. I have an orthodontic resident that I'm mentoring there, and she is proposing, she's going through the IRB proposal to collect on kids that present to the orthodontic clinic at Tufts, say they're 12 and they have, jaws are too far back like mine, and getting their ultrasounds from, Brigham Women's Hospital, wherever they were born in Boston, and comparing what the jaw looked like at 20 weeks in utero. And maybe there's an algorithm there that we can predict. And this could be something to, hey, maybe if, you should breastfeed rather than bottle feed. I'm very reluctant to talk about breastfeeding because I'm a guy. And if there's any women, that guy, he's never done it. He shouldn't be talking about breastfeeding. So, but, there's research going on. And that's what, James, you have really laid the foundation, is that there needs to be research and data collected. There just isn't now. We can look at ancient fetuses and say their jaws are forward. Well, something must have happened. What is it? Maybe it's the way the mom's eating, the way she's breathing. Gestational apnea is something James brought up. Who's heard of gestational apnea? It's in the literature. Gestational diabetes, gestational hypertension, gestational apnea. That could be part of it. We're proposing it.
And I can't help thinking that perhaps if the mother has difficulty breathing, if she is not eating a fully balanced diet, that this can have a downstream effect to the fetus. If a mother has sleep apnea, and is periodically hypoxic, that this could. But again, how do you test this? We can sit here and hem and haw all we want, but it's a pretty hard thing to test.
There's already been an experiment that was inadvertently done, and that's called smoking. Pregnant women, when they smoked, their babies were small for gestational age, sometimes preterm. So in cigarette companies in the 40s and 50s were advertising a win-win, the beautiful taste of Winston and a smaller baby, easier to deliver. No, wow. Really, I can show you ads. It is disgusting. But they've just shown that they know the long bones are smaller when a woman can't breathe well during, like, smoking. But how about the jaw bones? I mean, if the long bones, if the legs are small, why wouldn't the jaws be small? And that's kind of what we're going to explore at Tufts about this.
Well, it's interesting, and I'm curious. Like,
I just want to be very clear that.
Oh, sorry, I think we have a little bit of delay there, but I'm a little bit curious about things like chewing gum, or we have a question from Darren online who's asking is there equivalent of a chew toy to widen passageways? Like, are there other? I know that some things where you chew and you don't swallow can actually cause stomach problems, like chewing gum repeatedly. But I'm curious, are there kind of some chewing exercises that we can do?
I think there are oral pharyngeal exercises, which have been found to be very effective in increasing airway health, expanding airways. They've been studying these exercises for snoring and sleep apnea, and they have a not a subtle changes that are occurring in the airway. And what these are just exercises. So if we're just eating soft food all the time, we're not exercising this big powerful muscle called the tongue, right? And so everything back here can get flabby. But if you start doing these exercises, just like you're doing your curls or push-ups or whatever, you can start to influence some fitness and to tone these areas. So there are several studies, I think 4 or 5 studies, looking at just doing these exercises and their effect to improve your breathing.
Interesting. Oh, hold on, what am I? And Anne Marie from one of our streams is asking about how do you learn about the breathing techniques, and where do you suggest that she start?
You start with this incredible book called Breath. No, you don't need to do that. You
Yeah.
can. There are thousands of years of research into breathing, how to breathe properly, and there are literally hundreds of different books. I've found in my personal experience, the simplest things can be the best. Try to focus on your breath, try to breathe slowly, breathe through your nose all the time. Start with that, build that foundation, and then you can get into fancy pranayamas. But it's amazing how few people have proper oral posture, how few people are really breathing efficiently or in line with their metabolic needs. And so I think you really start with the simplest steps here, and then you can build up from there.
Nice. And that actually leads in a good next question from Dan, who is asking, what is your current life and health situation after learning all this, and starting from a path of doing breathing exercises and working your way here. And actually, I think in your book you talk a bit more about how you went to your first breathing class and it kind of freaked you out.
Yeah, it freaked me out. And, breathing classes are a dime a dozen here in San Francisco. You can't throw a whiskey bottle and not hit 3 or 4 places like holding breathing classes. So my doctor actually told me to go to a breathing class because I kept getting pneumonia year in, year out. I was eating the right foods. I was sleeping. I was exercising all the time. I kept getting sick. I kept having respiratory problems. And it did freak me out because I just started sweating in a way that felt completely unnatural. And so that is one of the things that really spurred me to research this more deeply. And it took me years and years to get my head around it, to understand exactly what happens to the body, what happens to the brain when we breathe in different ways, when we take conscious control of this biological function.
Interesting. And do you feel healthier now after doing all this?
Well, it makes you a complete neurotic when you're writing about breathing for 4 years. But don't do it, people. Trust me on this. But after that, the whole point of this is to do it in a certain way, to understand what proper breathing is, so it becomes an unconscious habit. You don't want to walk around like I did with, looking at an app or looking at a notepad. You want to be able to acclimate your body to slightly higher levels of CO2, to acclimate your body so that it's very comfortable breathing through its nose all the time and very comfortable breathing slowly. But I, as an anecdote, as a subjective experience, it absolutely changed my life. And the CAT scans show that a year before and a year after, doing some just very simple things, massive expansion in my airways. I haven't had a stuffed nose since then. That's been my own experience. I'm not going to say it's going to work for everyone, but if you look at the science behind this stuff, what happens when you do take control of your breathing, especially if you're breathing dysfunctionally or you're a mouth breather, it's not subtle what happens. And the science is very clear on all of that.
Nice. And Kevin, I'm curious if how, those of us with kids and, they do already have crooked teeth, and now, do you send them to a dentist? Can you find dentists that is there a catalog of dentists that kind of are understanding how to broaden these air passages and teeth palates?
Yeah.
Or how does that work?
Right now, something like this, an orthodontist will call me, pediatric dentist will call me, general dentist will call me. Look, I want to help, my dental hygienist kid. I want to help my own kid. I've got patients. I don't know how to do this, and we're setting up a coaching network. It's through the Academy. It's the American Academy of Physiological and AAPMD, Physiological and Medical Dentistry, AAPMD, and we formed this group called the Endeavor. And it's a consortium of about 20 myofunctional therapists, which are speech pathologists and hygienists that help kids do those chewing exercises that James talked about, but also orthodontists, pediatric dentists, and general dentists who see kids. And we are coming up with a way to teach dentists, that didn't learn this in school like I didn't. I had to learn this. after dental school, after my pediatric residency training. And we're forming this consortium of teaching dentists. Here's how you present a case. You show me 10 pictures of this 4-year-old in your practice. You describe the child's sleep and breathing, and we have definite validated risk assessment tools. And then you send them to me or one of the other 14 members, and then we will sort it out and we'll have a group discussion, and we will help you treat this kid, from afar. And then eventually we need you to take certain classes that are out there that you didn't get in dental school. But that's where it's going. And James has done more for this movement. James is actually the only non-doctor clinician that's a member of the Endeavor Collaborative. And he's done so much to raise awareness and help little kids. He has no idea how many little kids you've already helped, James.
Well, I will say I had the easy job here because I am an objective journalist going into a field that I knew zero about. I spent several years in it and talked to people like you who have been working on this stuff for decades and decades and decades. So I was just putting the pieces of this puzzle together. And one thing that Kevin hasn't mentioned yet is 100 years ago, guess how we were treating crooked teeth? We were expanding palates. So this is how it was done.
At 3 years old. At 3.
Yeah. When you expand a palate, you expand the airway. Larger mouth, larger airway. And so only in the 1940s did we start extracting and using braces and headgear. And in Europe, that expansion lasted a lot longer. So that was a part of the presentation that got cut out, but it's all out there, and it's all in the scientific literature, and anyone can look it up.
Nice. We're going to welcome one of the founding board members of Long Now, Kevin Kelly, and the editor-at-large from Wired. Welcome, Kevin Kelly.
Hello. How are you guys doing?
Good.
Hi, Kevin.
I'm the second Kevin. Okay.
Yeah, a couple Kevs.
You have Dr. Kevin and you, Kevin.
Yeah, that's right. Yeah. I am not a doctor. I have a question. One of the this is for the anthropological side, but it was always my understanding that when humanoids invented cooking, the discovery of control of fire and cooking, which acted as a kind of a secondary outside stomach that allowed us to digest nutrition that we could not do easily, that actually changed our jaws and our teeth in the historical, I don't know whether it was a million years or certainly hundreds of thousands of years. And so I'm wondering if what we're seeing now is kind of a continuation of that longer story.
That's exactly what happened. So 800,000 years ago, I think that's one of the earliest discoveries of the use of controlled fire. And so having all of this extra energy available that we save from chewing that was released in cooking allowed us to grow a larger brain. And that brain needed space. So it took that space from the front of the face, and our faces started growing flatter, okay? And our teeth started getting smaller and our jaws started getting smaller. But these changes happened over tens of thousands or hundreds of thousands of years. And we acclimated to these changes just fine. So according to the skeletal record, we were breathing just fine. So what has happened to modern humans in the past few hundred years, this happened so quick, we have not been able to catch up, right?
Okay.
So our mouths are way too small, our teeth are crooked. Right. Airways are crooked.
But the general trend, though, is a continuation of that trend, right? Of reducing the size of the jaws and the teeth. So you could kind of say that it's sort of like a continuation of that same process of modernization and eating cooked food.
That's like saying obesity is a continuation, and we're just going to keep getting fatter. And I know exactly what you meant there, but no, we have to stop this trend. I mean, narrowing jaws and obesity, they're one is overabundance and too big, and the other one is too small and under achievement, if you will. It's just it's a trend that has to stop. But yeah, if it continues, it's disaster.
So if you take kind of, again, the long view, and this time going not the long past, but the long future, if you imagine some scenarios for the next 100 years, what would our jaws look like in 100 years? Do we imagine that they would be the same size they were in the last couple thousand years? Would we like to, have we identified any genes of our jaw size and teeth that we might want to engineer to make larger? Or, I mean, like, if we could imagine us taking control of this, what would you imagine we might do? You can have more than one scenario, but what would be some of the things we might do in 100 years regarding our jaws and teeth size?
To me,
James,
yeah, you know, go back to eating whole foods is the first thing that you should do. I mean, we want to live up to our epigenetic potential, right? We don't want our mouths to continue growing smaller and smaller and smaller, and our teeth to be getting more and more crooked. So genes can be turned on, they can be turned off. So if we see this disevolution happening right now, if we've taken a sharp left turn, if our airways have taken a sharp left turn, we can work to help restore that. I've found even if you're in middle age, you can show improvement to your palate. You can show improvement to your airway. So the body is plastic. I was just talking to someone about neuroplasticity. I think we should be talking about breathing plasticity or mouth plasticity. The human body can be changed for the better or for the worse, depending on what environmental inputs are given to it.
And so, Kevin, do you have an idea of what might happen over 100 years? Again, what some of the possibilities would be?
The genes, you know, there isn't a gene that, or a suite of genes. You know, there's just not one gene, one trait. It doesn't work that way. Very seldom. There are a few things like that. Is that there's groups of genes on individual chromosomes that interact with genes on other chromosomes in concert, interacting with the environment. It's epigenetics. So you can have a group of genes that will code for type 2 diabetes that never expresses itself if the person lives a healthy lifestyle. You can carry those genes, but they just won't turn on unless you subject it to an environment. And it's the same thing with malocclusion. So in the next 100 years, you know, people are going to wake up. I mean, you know, James has an acumen for anthropology and natural selection that rivals, like hugely rivals, most healthcare professionals. We don't have to learn about how natural selection works when we're in medical and dental school. You know, we deal with proximate cause. You got a fever, take an aspirin. Well, maybe we should find out what pathogen is causing the fever. And James has really grasped such an understanding and an appreciation of how important it is to understand the evolutionary explanation rather than the proximate cause of disease. So getting to your question, like, well, is it a linear projection in 100 years? Like if the jaws have gotten this small in 100 years, what's it going to be 100 years from now? And it won't be linear. I think if it were that, it would contribute to human extinction. And I just don't think people like to think that humans can go extinct. A lot of that is religious, but we can, like every other species on Earth. 99.9% of everything that's ever been born from the first bacteria 4 billion years ago, everything's extinct except a few things that are here now. And that's where we're headed if we don't get, you know, this and other things. Breathing properly through the nose and having jaws that are conducive to that and taking in adequate nutrition. We're smart. We have a big frontal cortex. Lucky for us. We better start using it.
Nice. Well, we're going to wrap this up, and I'd love to thank actually both Kevins, Dr. Kevin Boyd and Kevin Kelly, and we'll just go to James and I I give the last couple of questions. Thank you guys. James, I think Dr. Kevin Boyd did a great job of pointing out how bad I think many times when people are siloed in their professions, they're really bad at kind of connecting the dots. And we've seen, you know, over and over again with some of our like all species initiatives and the language initiatives that it's rare that people can, you know, they actually kind of get academia really rewards specialization and doesn't really reward generalization. And so the work that you've done here and kind of helping these people kind of connect with each other, I suspect you, even in your research, you help them find each other to some extent in what they're doing. So I think it was a great effort and so cool to see. And so I'm really curious as to what your next project is.
I have another book idea, but the idea of sitting in a room for 3 years and writing alone just kind of makes me queasy. So I'm gonna just continue talking about breathing for a little while longer. I'm still excited about this subject. Every time I talk to Kevin, I get all amped up and I want to get this word out. But hopefully, we're going to bring this and some of the other subjects I've talked about at long now into a different medium. Perhaps into a video kind of series, and so I'm looking into that. But in about a year, I think it'll be time to sink back into a new project.
Cool.
Book project.
Yeah. Well, we're all stuck in rooms in front of our computer screens now, so we're all writers now. But yeah, I think
we've all got beards now, everybody.
Yeah,
we've all got long hair and beards. So there it is.
Nice. Well, I want to thank you for your book, and I do want to say, like, that you did a great job of kind of going down a much more long now angle of what your book is, and there's so many more great stories in your book, and I really want to encourage people to read it. It reads really well, and I've been listening to it, or I ended up listening to all of it, and you do a great job reading your book, so it's great to hear your voice in the audio version, which I enjoyed. So thank you so much for joining us, and thank you all for joining the live stream, and look forward to. I think we're coming up on our last event of the year. Will be Lost Landscapes, which will not be one of our normal events, but we'll be back on in January, and hopefully on the other side of 2020. Thank you all.
Thank you.